Hello, everybody. Welcome to another episode of The Root of the Matter. I am your host, Dr. Rachaele Carver, and today we have the privilege of speaking with Samantha Lander, who is a functional diagnostic nutritionist and became certified in this type of medicine after going through her own journey, just like myself. So, Samantha, let's just get right into it. Tell us your story and how you got into the holistic health and why you're such a fan of biologic dentists.
Well, I have that classic story where I was just sick all the time as a child, chronic stomach aches, just extreme fatigue, and nobody really knew. My dad was Western medicine. So I just got kind of like, spaghetti thrown at the wall constantly until, I think part of my story, it's important because it does pertain to my mouth. But I then, part of why I was actually, this does pertain. So part of why I was sick a lot is I had a deviated septum. And so I was a super mouth breather. And we know, if you are a biological adult, that it dries out your teeth and it can cause a lot of mouth issues and structural issues. So that is partially why I was sick a lot, because I got a lot of sinus infections. And so I ended up doing the deviated septum surgery and when I was in high school, the first one. So just chronically sick. And then I sort of was always in the health space. I did eventually start using a lot of drugs at a period of time in my life. So I would say it was, to me, when I look back, it was the only time I could get out of my way and not think about how bad I felt. Because it was just always like some sort of inflammation, or I was sick, or my hormones started to get really messed up as I was getting older. And, self medicating for ADHD. My drug of choice was meth and GHB, and eventually led me down the road of selling drugs. And then I Oh, it's weird because this is so much of a mouth story. I'm gonna just put it into that. So then so I was a mouth addict. I was a mouth breather. My dad does have bad teeth. But then I did end up getting sentenced to go to prison for selling drugs. And I had a dentist at the time, just a normie dentist. And I don't know if it was a money racket or what it was, but it was like, we're gonna just drill out everything and give you and do root canals and add fillings to everything. They pulled out some metal fillings that I had. So at one point I did have mercury fillings. They were not done the smart dental technique at all. And I got like maybe one out, and then later down the road I got more out. And I- it, I think it was a little excessive, but I think she told my parents like, well, she's going to be in prison for 27 months. So let's go to town and make sure she's going to be okay, because there's no dental care there. And, that was it. So I got out. I became a personal trainer. And so it was sort of like I worked out all the time. I counted calories, because that's what you learn when you become a personal trainer. And then I realized very quickly that it's so much more than just that. And I was having my period every other week. I had chronic diarrhea, and I was just super, super sick. And that's when I got into the functional stuff. So I started running the labs on myself. And then I realized very quickly I wanted to be able to run the labs on my clients. And that's when I became a functional diagnostic nutritionist. So I've been doing it since 2010. It's, been great. I was a personal trainer for a period of time. And then do you want to ask a question, or should I keep going into the mouth
Keep
story?
going. Tell us the whole
All right. So what happened? So fast forward, I had a lot of dental work here and there. It would sort of be like I'd go to the dentist and everything would flare up, and then there'd be some big thing, and then I'd be fine for a period of time. And when was this? It was 3 years ago. So it was, I don't know, maybe 2023, around then. Maybe a little bit before, I just got really sick and I couldn't get out of bed. I felt like I had a horrible sinus infection, and it was sort of isolated in my left sinus. And I was taking antibiotics, I would get better. And then quickly within 2 months, I'd get sick again. And it got to the point where it's like you couldn't get out of bed, like fatigue, like it wasn't normal. And I was like, I just knew something else was going on. But I got into a hyperbaric chamber. And when I got into it, I could feel it in a tooth.
Mm.
And the pressure in my tooth was so unbearable that I went to and then I was like, something is not right. So I went to the dentist and I was like, there is a crack in my tooth and I need you to do something about it. Like, I didn't know at this point, I knew nothing about biological dentistry. Like, I was in the functional space. I knew about like mercury fillings and all that and the smart dental technique, but I did not know what I know now. And nobody would do anything about it but a root canal. So I got a root canal, right? So I did the root canal and I got a little bit better. And I think it just sort of sealed maybe the crack a bit for a period of time. But then I had my upper left tooth. It just the pain was severe. So the nerve was damaged, and what do? You get a root canal, right? So it was on a Sunday. I was in so much pain that I went to an emergency dentist, and he did this like 20-minute half root canal procedure, right? And just like it was the weirdest thing. And even I was asking the staff, I'm like, this is not normal. Like, what is it? Does this guy have to get somewhere? Like, it was done within like 10 minutes. And I'd had root canals. Like, I knew something was off. And the next day I went into my dentist at the time and I said, they were like, okay, we're going to finish this out. And I said, well, I should probably start antibiotics. Don't you think? Like, something doesn't feel right. So I'm going to go home and I'll start them. But like, and it was so infected that they couldn't, the numbing wouldn't work. So they couldn't even numb me. So I had the root canal finished out with no numbing. They sent me home. Oh yeah. It was like strapped down. This is just the beginning. Strapped down in a chair. They finished it out and I went home and my face, I don't know if there's video on this or not, but my face was so swollen. I mean, I can give you pictures and it just became so infected. Like I can't even, like I've never been so sick. I was dry heaving like outside of the office the next, like by 2 days later. And I went in and I was like, I'm not leaving this chair until you do something about this too. And I mean, really, it should have just been pulled. And they ended up, they're like, we're going to give you a double stack of antibiotics. So they put me on clindamycin and maybe Augmentin together. Oh, I lived off antibiotics for 2.5 years. It's all I could do to be a mom and to run a business. And um, and then I said, you guys have to like drain this. There has to be fluid. And so they ended up draining it, and it was like a pint of just like fluid that they pulled out. And I mean, it felt so good, right? I was just like, okay, a little bit of relief, and called in codeine and some more antibiotics. So I went home, and it got a little bit better, I would say, not much. I always had this like weird feeling in my sinus, like I have a massive loogie just hanging out there. And, fast forward, like I finally learned that it's referral pain. It never had to do with that tooth or not. And this is when I started sort of exploring biological dentistry and like something else it just didn't feel right in my gut. And I did have a bridge from when I was younger, like way younger. I had a bridge tooth, and I had gone out of town and the bridge cracked off. So here I am with like this cracked bridge. And eventually I said, I just want to pull that tooth. I want you to pull that tooth. And they said that they can create this bridge with the root canal tooth. They're going to put a post in it. And I'm like, there's no way that's going to be okay. Like, you're putting it into a damaged tooth. Like, at this point, I'm slowly learning more and more. And I did find a biological dentist in town, and he ended up pulling the root canal tooth. So that was the first tooth that we pulled. And so that was no big deal. It was kind of one missing. And then eventually I ended up, because I just never got better. I would go on antibiotics and then I would stop them. And then I started just doing like 3 days at a time just to kind of get my bearings and then stop. But I always had this nodule in my sinus. Like, it just never, and I didn't, like, the only time it went away is if I went on steroids. And that was down the road. Like, I didn't get introduced to those, thank God, till later because I felt great on them. But they ended up pulling that tooth, nothing got better. We ended up pulling the half root canal tooth, nothing got better. So basically my entire left side, every single tooth got pulled, and I was not better. So then I went to an ENT, and because I was like, something is in my sinus. At this point, I had put Botox into my jaw. I thought it was TMJ. I mean, you name it, I had probably done it. I was doing the neti pot. I was constantly on the antibiotics. Um, and silver spray, all the things, clove oil, like, you name it, I was doing it. And I went to an ENT. I went to 6 ENTs. Yeah. So I fired the first 5. One said that they found 2 of them, like, they didn't even do like an MRI or anything. And then I finally went to one that ended up doing a scan of my sinuses, and they did find cysts in my sinuses. And the 5th doctor gave me a script for nerve blockers, pain management, and antidepressants. Like, literally, I had spent 60 seconds in here with this guy. I was so sick. And then at the very end, he goes, well, I haven't even looked at the imaging. And I was literally just like, fuck you. And I walked out. And I finally found this amazing ENT who just put up with my insanity because I didn't really know. And he said, well, your septum is deviated. Like there's an issue again. So we can go in and we can fix that. And that's because I walked into a door, I think a couple years prior. And, we'll go in and remove the cyst out of it. I think that's what it is. I think that's what you're feeling in there. We're going to go and do that. So here I have no teeth. I did get a partial. I may have had, there was a one tooth down here the one that cracked with the root canal. I ended up pulling that one because I thought that would make me feel better. And then I ended up doing the deviated septum surgery, going to my biological dentist the next day and pulling out my very back molar because I would get this like shooting pain that would just kind of shoot down and I was getting like zingers, they call it. So it felt like electrical pulses would just like zing through the tooth. So that was a new thing for me. Like I'd had a lot of things with all of them. But and so literally he went to pull it out and the molar just popped right out. He's like, I've never seen a tooth pop out like that. And I'm at my biodontist by now. We're doing PRP, we're doing ozone, we're doing everything. And dry socket because I had the sinus surgery. It was like everything that could go wrong. I was like just bleeding out of every orifice because of this sinus surgery. It was so bad. This was not this November, but the November before. And at that point, like I was sleeping in rooms with like EES systems. I was so sick and I was just like, I'm done. Like I'm gonna die and I'm gonna be sick. And I'm gonna tell it's like my tombstone's gonna say, like, I told you I was sick, right? Because I had exhausted everything. Like I had tried, maybe it's my hormones, maybe it's my gut, like whatever. Like at that point, my gut was shot because I was living off antibiotics. And then I was added in steroids at that point. But I did the surgery, nothing was better. And then we kind of just waited out until so what was it? So in January, I believe so I ended up getting my implants put in somewhere along there. I don't remember exactly where, but that was before the sinus surgery. The implants went in. We did 3 implants. I could not afford ceramic at the time, so I did not do it. We did metal testing and we did all of that. And my doctor had not started doing it. And Dr. Dom was like, just fly out here and I'm gonna overhaul your whole mouth. I'm like, I really can't, like, I can't really do that. Like, I can't, he says he does that and it would have worked, but like, I had bone spiculas, like, who was gonna take that out? Like, nobody would have messed with my mouth. If I went out there and did everything and came back, even my biodentist, I don't know that he would have even touched me because I had bones. There were points where we had to, like, shave like, the molar teeth when they came out, the way that the skin was healing over it, it was like there would just be bone, like, just pushing through, and we'd have to go do surgeries and, like, this side was really bad, and it was happening there. Like, I'd be home, and I'd just take a knife and, like, rip it open. I mean, I got where I could just pop bone out of my own gum myself. It was insane, and so one of the implants did end up failing because there wasn't enough bone, and that's where the tooth was where I lost it when I was little. So I did end up getting the 2 implants, and then they added a little bit to, like, close it up on there, and then I just was, like, buying time to start attacking this side. So I pretty much have no teeth, and I just got it, but I had one missing over here. And oh my God, what happened next? It just kept going. It just kept
Well,
going.
yeah, it sounds just crazy. And after going through all that, what kind of resonated with you that might have been, the cause for this constant pain and
So
feeling?
so there was always over here, like I would get like inflammation in my gum is what it felt like, but it would just be so sore. And I'd be like, you guys, like something is going on over here. Like something is going on. And we knew we couldn't really do a lot because I wouldn't have been able to eat. And, it just everything takes 3 months or another 3 months. And so once I got this side done, I ended up uh, pulling that tooth and where that was. And it turned out that that tooth was actually like growing. It was like, I don't know, growing, but it was like sideways into it took like literally 3 hours to get it out. It was insane. So it was like bent and turned into, and it could have been pushing a nerve. I have no idea. And after that one, I felt really, really good for a good period of time. And I always had one up here that was just a really old root canal that like eventually like the crown fell off and like it just needed to come out. So we did end up pulling that at one point. Did we think that was the one that showed up on a cone beam that was like super infected. And so they kept saying, "You gotta get rid of it." I felt no different, like nothing after that one. They were like, "That's gonna be it." Pulled that, nothing. Then I pulled this. I felt really good. So I had a period of time where I felt really, really good. I was like, "This is it. I feel great." Like we figured it out. It's like we almost got every single root canal out at this point. I had one more left. And at this point, I did start integrating a lot of peptides with my so when I started working on this side, I just started injecting BPC-157 and TB-500 into my gums. Just and the first time I did it, I literally just watched because I had these like sweat, all this swelling under my eyes. It just within a minute was gone, like completely gone. And I was like, whatever I'm doing, I'm just gonna keep doing this. Like this is amazing. These peptides are amazing. I mean, now I've fully integrated peptides into my practice. Like I'm part of faculty with Peptide University. So like peptides are beautiful and they were my saving grace, and so I started doing that to help with the healing process because my immune system was just shot at this point. Like, there was not I couldn't even handle taking, like, a multi-herb supplement barely. Like, I just was and I was so tired, and but I did feel a little bit better after that one, like, sideways tooth, and then I would say it was about so it was May. I start, probably the beginning of May, I started to get the, like, shooting pain again. And it was I had one more tooth, like, I didn't have any other teeth, and I had one more, and I started to get really tired, and I was able to, like, fight it a little bit more than I did before, and I had a really big presentation that I knew, like, this speaking presentation that I was like, I gotta make it to May 21st. That day, I mean, I could feel you could feel systemically the infection running, like, through your body, like, I could feel it, and it was sore, and I was like, "It's that tooth." It's like, "It's that tooth," and, I mean, at this point, like, my dentist thinks that I mean, I've been in there crying, I've been in there it is, like, the most emotional shit, and then when they pull a tooth, like, I had one they pulled, and I started crying in the chair for literally an hour,
Mhm.
and then I felt like my lung capacity, like, quadrupled because it was connected to my lungs. It just like, I went through, like, the meridian chart, and I got that next Monday after my presentation, I got that tooth pulled, and that was it. So, I have been, like, a rock star since then, but, I mean, I just do peptides. I did end up getting wait, so 1 implant here. I do have the implants up here. I have an implant up here, so I just have one more, crown to get, but I did end up doing a lot of implants, and the healing process was absolutely remarkable due to the peptides. They were gonna redo like, this one, they were gonna do more bone grafting and a membrane surgery, and my 2 dentists literally thought I went to the other dentist and had extra bone grafting and, like, membrane surgery, and I'm like, "No, I just do peptides." I'm literally just injecting peptides in my sinuses, and they're like, "We've never seen anything like it." So, I got cleared to put a crown on my upper, uh, tooth that we did an implant within, like, half and it's been great. I just got, like it was probably last week, we redid some crowns because they weren't fitting well, but I got 1, 2, 3, 4, 5 crowns. I have teeth now,
Yeah, they look beautiful.
and I got 1 more. Yeah.
Yeah. So, yeah, crazy, crazy story.
I mean, it's the root but, I mean, all we can say is, like, we pulled out every root canal,
Yeah. Yeah. Right. And
you know?
so, we've talked a lot about the podcast, obviously, about root canals and the potential to affect us systemically, but because they're a dead tooth, we often do not feel it. Now, I would surmise that you're more of a sensitive human being so that you are more in tune with your body, right? A lot
Yeah,
of us,
yeah,
after childhood, we drop consciousness level and forget it. We're totally out of touch with our bodies. So
yeah.
it always drives me nuts when a patient comes to me and they say, "Well, the doctor just said, kind of wrote me off and said, just give it time or whatever." And even it's frustrating as a dentist to look and not be able to find something specific. But I
It's
never,
hard to see,
yeah,
yeah,
I
that's the thing is that you
never
can't see
negate
it.
a patient. And sometimes I will look to the patient and say, "What do you think is wrong? You're the one living in your body. So what does it feel like to you?" And, patients aren't used to being asked that. Right.
Yeah,
And so
yeah,
some of them just kind of like, huh, well, now that you mention it, I think, blah, blah, blah. And I think that's one of the roles as a biologic dentist is you're looking at that whole body. And that includes the mental, the spiritual, all those other aspects of a person. And we cannot
people.
forget, just because we may have all these letters after our name, doesn't mean we know what it feels like to be in somebody else's body.
Yeah,
So,
Yeah.
I think that's a big difference when you have a biologic philosophy is that you
Yeah.
know emotions impact these things, spiritual, the environmental factor. There's so many things that impact our physiology that we need to go
Yeah.
beyond the biochemistry, right?
Yeah. Oh, yeah, for sure, and I mean, it was just, and you feel like you're crazy, but when I look back, it's like every time like, by the end, I was like, "Nope, I know. Like, I know. Pull it out. Like, I don't care. Like, I'm so used to pulling teeth at this point, whatever." But in the beginning, it's like it's your teeth. Like, it's you don't pull teeth, that's, like, so abnormal, which it probably should be a little bit more normalized. Like, my clients, I'm like, if it's in the back, I'm like, "Just pull it. Like, just pull it. Like, you don't need it. Like, trust me." You're gonna feel so much better. But it definitely like I knew, like if you listen to your body, those symptoms are telling you. So like, and you have the gift of understanding like the organ meridian chart and then all the people you have seen, and you'll know like, okay, do you have knee pain? What is your like? I had the knee pain, that left knee pain. I had the toe that locked up. I
Mhm.
mean, my toe, my big toe, totally locked up till I pulled the tooth that was, like, whatever, connected with that one. Like, it's just insane. It's not insane, but it's the body.
Yeah.
But yeah, yeah.
It's great. So, you know, our audience, I haven't really talked about peptides much at all, I don't think. So, explain to the audience and people who may not know what a peptide is, what is a peptide and why was it so instrumental in your healing?
So peptides are a molecule that your body naturally makes. So it's just amino acid, and you can get them in capsule form or injectable or nasal sprays and all different routes at this point and patches. But it's going to go in and it's going to kind of turn on certain receptors and turn them off. So one that people can probably relate to is a GLP. So a GLP is a whether retatrutide or tirzepatide or semaglutide, those that is a peptide. Insulin is a peptide. So what are we doing? The mechanism of action for a GLP is like we're going to turn on, we're going to slow gastric empty time, we're going to dim that reward center, and we're going to help burn fat. So different peptides have different roles, and there's a bunch of them. And for me, thymosin alpha 1 is sort of the one that just sort of boosts that immune system. KPV can help you with that mast cell histamine. So my body was so overloaded that I needed to just basically calm it down and then build it up at the same time. So thymosin alpha 1 is always a really good one, I think, for dentists, and KPV. I did injectable on everything with BPC and BPC-157 and TB-500. That is a very common one that a lot of people are talking about. It's they call it Wolverine because it's body protecting compound. Like it's basically going to protect your body from inflammation, and it's also going to repair tissue at like a rapid rate. Gut healing, surgeries, anything like that. I didn't add in copper. That's a big one for tissue. But like copper stings, and I'm not about to inject that into my mouth. But I do, and injectables of that. But the BPC 157 and TB 500 is known for how it protects the body and it heals the tissue and repairs it. And you will hear story after story, even with my clients, where they have a potential situation where they're going to have surgery on their shoulder or their knee, and they just start doing it in their knee, and next thing you know, they don't have to have surgery because
That's
it's that
happening to my
powerful.
brother. He started taking the BPC-157. I was, getting it for him, and he's like, all the arthritis, everything, he's like, "I
Yeah,
feel like a totally different person. When I run out of it, I feel the difference," and that's
yeah,
great now because that one's so small, you can take that one orally. So,
yeah,
I even give that to my teenage daughter, to help her diet's not great, and so I just got a lot of skin stuff. So I'm like, if we can heal your gut, because I don't want to put her on the Accutane, I'm trying to avoid that kind of stuff. And it was making a difference. Now the problem with her is, the consistency of it, because
yeah, yeah.
again,
And I don't know.
but yeah, you need to.
Yeah, I don't know if she can do yeah, I don't know if she can do injectables, but KPV, like an injectable KPV is really, and glutathione is really good for acne, but
Mhm.
also doing like a proper GI panel is always like,
Yeah,
really doing a comprehensive like 6-day stool test
yeah,
during the full moon when parasites are breeding, maybe do some biofilm work prior. You'll probably figure out what's going on. But it could be hormonal. We got a lot. Women got the hard. We have to do it all.
yeah. She's been a gut issue for and she knows it too, and she complains about her skin. I say, "Well, where do skin problems come from?" She's like, "Oh, the gut." I'm like, okay, well,
Yeah.
you can kind of control what you put in your mouth. So I don't know what to
Yeah.
tell you. But it's interesting. I was just listening to a podcast earlier about peptides, and we're fortunate now that in the FDA, the leaders now are open to the peptides and they believe in it. And, it was one of those things just like homeopathics where they were trying to, you know, get it out of the country. These are things that are so safe. They're
Oh,
peptides are a little more expensive than homeopathics, but relatively affordable compared to these Wegovy. I mean, my goodness, Ozempic, this is like bankrupting insurance companies. It's so expensive, they're not
yeah.
covering it a lot of times. So,
Yeah,
and
the
these
F
are effective ways, right? These are, like you said, these are things that our body makes by itself. And as we get older, we're not as efficient as making these. And these are some really great ways to help the body heal, especially someone like you who had so much damage to your
yeah.
gut and the inflammation, and especially the histamine. I didn't know that about KPV, that it was
Oh, yeah, I
beneficial.
use it for my chronic illness where people I have, like, it's either they have mast cell, but, like, they typically have mast cell, but they also have, like, Hashimoto's or Lyme or all these other things, so they can't even take, like,
Right.
an herb, like, it just flares them up, so we do lorazepam, which is an amazing, molecule that you can do that just seals those gaps in the gut, so before I even do KPV, we'll put in, like, some lorazepam that kinda calms it down, but then we can slowly add in the KPV because if you just throw them on it, it'll flare everything up too, but it can help too with any. I mean, you could even do some, like, I mean, LL-37 can be kind of an antimicrobial and like a biofilm peptide, but, obviously we listen to the story of what they have going on, and, like, I mean, with me, like, I had so much going on. I mean, there was a point where, like, I would eat certain foods and my whole mouth would swell,
Yeah.
but I mean, I was infected, like, with what? I still don't necessarily know, but, like, I mean, I assume it was my teeth and then nerves and, I'm so convinced because I had so much pain here, and that's all I focused on, and it was always like, "Oh my god, what do I do here? How do I get this?" Like, I'm spraying stuff in my nose, I'm doing this, and nothing ever worked, but it was always it was the second I got that taken care of, it just, like, went away.
Yeah.
It's funny, it
Well,
kinda
and
feels
it's
weird, but
interesting, with the Heidi, you kind of hinted to it about referred pain, right? One of the most common ones is an infected wisdom tooth socket, which affects the upper teeth, right? Because if you
yeah,
think of the facial nerve, it's like a hand, you put your palm against your face, and that cavitation way back kind of near the root of that nerve, right, can affect anywhere along it. And that's very common. So again, you want a dentist who's going to understand that whole picture and be like, okay, because a lot of
yeah,
people end up getting root canals and they might not necessarily need it, right? And so it's like, oh, that didn't work, right? So then we're going to do the tooth next to it, and then the one next to it, and then the one next to it, and and then you
well,
end up with your case where
yeah,
you have to have so many teeth removed. So it's
and
really
they wanna
understand. You got to
yeah,
understand that. And that's why the meridian chart is interesting. And again, ask what are other your symptoms. I've had a lot of patients who would get joint replacement, and a few months later, the tooth on that same meridian starts hurting. And I'm like, interesting. Energy is not flowing well along that, right? Because there's scar tissue, right? There's all sorts of things that happen, even with, I mean, these are very, surgeries that happen all day, every day.
yeah,
And no matter how well it's done, right? If you are cut open in any way, you're going to have fascia,
yeah.
moving, and that's going to prevent the proper flow of energy and nutrients and all this kind of stuff. So it's important. People kind of think, well, why does the dentist need to know my medical history? Because everything is connected, right? We
Oh,
really need.
high blood yeah, I mean, like, high blood pressure, I mean, you name it, I think
Mhm.
it's all, like, just super important for sure, like, I mean, I had so much pain running through my body at the time,
Yeah.
like, I could barely walk downstairs, and then just, like, the inflammation, the amount of weight that I was just, like, putting on, and I wasn't gaining weight, I was just, like, holding water because I was so sick, but that water then hurt every joint hurt, everything hurt. I forgot I did cavitations too. God,
Yeah.
I did both sides. I did it all. It was great, and it didn't even touch the surface, but,
Yeah.
yeah, I think there's just it's something it's a growing topic, the biological dentistry, which is great, but it's so important. It's so important.
Well, especially with clients, I'm sure you're working with these clients that are really sick, and it's that can be the final piece, right? But again, because nothing hurts per se, doctors and other healthcare professionals don't think about the mouth, right? One, they're not trained to have to know anything about. I mean, even us as dentists, we're not trained to think
No,
holistically about the mouth, and and all these meridians and all these things. I've just learned that on my own health journey, and and opened the door of like, oh my gosh, there's a whole nother way to practice dentistry. This is
Yeah.
amazing. So what do you think, having had all these major chronic issues, what was the most important thing you think that you learned that can be for somebody who's like really sick like that can't get out of the bed, right? And they're probably diagnosed with chronic fatigue syndrome, right? Which is basically like, we don't know. Here, just we're
Yeah.
gonna slap
Right.
this title on you. For somebody who's really struggling with that, what do you think's the most foundational thing they need to start with?
Diet. You diet. You gotta clean up your diet. I think if you start to like, if your detox pathways are working and you clean up your diet and eat whole foods and get inflammatory foods out, whether you run a food sensitivity test or you just, pull out what you think are gonna be the most common ones and just try to, high protein vegetables, things like that, and get those drainage pathways working, balance hormones, and then clear out the gut. And if you are not better, there's something else going on, because that's what I was doing. I did it all, and there's absolutely no reason a person at the level of health that I got to that should be that sick. So
Right.
if you are doing the right things, but I know it's hard when you are that tired. It's so hard to even like comprehend something like that. So, maybe just be open-minded and start going to holistic practitioners or functional or whatever, and go find like a true biological dentist, not like a functional dentist. Or I think, getting to someone who's like a biological dentist and really understands, they can do a cone beam and just kind of take a look at what's going on. Podcasts are amazing. I
Yeah,
mean, this alone, like, educate yourself. That's what I
absolutely.
did. I just started listening to podcasts and podcasts and podcasts, and I'd go and I'd come back with all this stuff. I'd be like, "Okay, so here, at the bottom of this tooth, there's this going on," and then and I'm like, "Oh, so I just got a bone spicula," because he wouldn't answer on the weekend sometimes. I'd be like, "Oh my god, what is happening?" And I'd be like texting Kelly and then, DMing Dom, and I'd be like, "What is happening?" They're like, "Probably a bone spicula coming out." I was like, it's just different kind of pain, you know?
Yeah,
So, I think diet is super important, you
yeah.
know?
What do you think? So you learned,
I prayed a
the
lot.
testing. What do you think is a really good, initial test to really see what's going on under the hood? Obviously, we get blood tests all the time, and usually they're just junk, right? They're not informative at all. So thinking about a functional test, what's your favorite to kind of start with?
I do a lot of food sensitivity testing, but that's just real. I think that's still a little foundational, but I think the Dutch test is a really good test. I like that it taps into like methylation and some of the gut markers and neurotransmitters. So like transmitters are low, they're made in the gut. So that's a sign of, if that's off, that's a sign of a gut infection. Methylation can cause a lot of inflammation. So, if you're a poor methylator, you could potentially have, MTFHR. So that's going to cause a lot of inflammation. For me, I've always chased inflammation, like thinking something was wrong, my gut's wrong, my teeth are wrong. Like, why is everything so swollen? And my markers are great on any biological test, but I have the gene variant. So I ended up testing, and so I have two of the SNPs, and my kid, because I was doing it because my kid too, and he has one, and I'm like, oh, I'm not really like inflamed. I just can't methylate. Oh, and I did support myself on it, but like now, like knowledge is power. It gives you a little bit of ease. Okay, this is what's happening. It's not because I ate a piece of broccoli. That's not what's causing the inflammation. It's not necessarily hormones. But if you're a poor methylator, it's gonna cause more estrogen dominance, and that can cause a lot of inflammation. Like, I could cycle, like, I have PCOS, but, like, I'm cycling, but I could tell, like, when I would ovulate, everything started to just get so swollen, when I was going through this, like, the past 3 years. Like, it was like my uterus hurt to the point where I couldn't sit down, and when that would happen, my teeth would get worse,
Mhm.
and to the point where I'd be like, "Just pull anything out," and I'd be in there, like, twice a week, and I'd be like, "I don't know what's wrong. I don't know. Do another X-ray, do something." Like, "I don't know," and they're like, "Sam," and I'm like, "I am telling you something is wrong," and because it would be that one where the gum would flare up
Mhm.
every time I ovulated, and I'd text all the big guys, and I'd be like, "What's happening?" They're like, "Well, there's more blood flow, so maybe." I'm like, "Well, you guys need to look into this
Mhm.
and figure it out because I can't take any more." Um, yeah,
Yeah, right. And I
and then
think a
I
lot,
and then a GI panel.
yeah, with pain, I'm always thinking, energy flow, and the uterus is of one of my, good friends, Kelly Kennedy. She thinks like, uterus, ovaries, that's all lymphatic tissue, right? And so when that gets swollen, you can't drain very well, right? you get
Yeah.
the pain, and it goes everywhere. A lot of us don't drain very well. We can detox, but
Yeah.
we're not great drainers. We sit so much of the time. Modern humans are just sitting all the time, and we have to. The only way we can move the lymph, right, which is kind of like our sewer of the body. Basically, we've got to get up and moving. And
Yeah.
I see this especially in kids today. They're just, mine included, they're just attached to the phone. They don't get out of bed. It's so frustrating to watch. But so you talk the Dutch test, which is it's a hormonal test.
Yeah, it does hormones. It tests the cortisol, which is important. I think you need to support your cortisol rhythm, and then
Mhm.
it gives you a good glimpse into, like, you need to get in the sun more, like, you
Yeah.
need to, like, try to fix that circadian rhythm, like,
Mhm.
I mean, it's obviously, like, I'm really like, I do, like, all the crazy biohacking stuff and peptides that cost you a fortune, all those things, but, like, I mean, seriously, get outside in the sun, go for a walk. You may feel horrible, like, but you're always gonna feel better when you go for a walk. I mean, dry brush. If your lymphatic system, it takes you 1 minute to dry brush your body the proper way before you get in the shower. Like, there's something that start drink water. I'm horrible at drinking water, but that's my one, like, pitfall, but, like, you know what I mean? There's things you can do for sure that aren't so aggressive, but they will move the needle. Castor
Absolutely.
oil packs are amazing. I was rubbing castor oil on everything, like, I mean, you name it. I was red lighting I would sleep with I have a little, like, I got the portable one, and I'd wake up at night, and I would open my mouth and just, like, lay there and have it in my mouth, and then I put it on my cheeks, and I put it on
Mhm.
because I didn't like, I was like, "Well, it's inflammation, I just need to bring it down, it's gonna help heal it, whatever," and I lived with that thing on my face. I would be on calls with it just on my face, like, all the time because
Mhm.
I didn't but whatever it takes,
Yeah.
you know?
One of my other favorite tests is the organic acid test because that will
Yeah,
really look at, how are you metabolizing certain things, right? That looks into your
yeah.
mitochondria. How are you absorbing and digesting, proteins? That also looks at the neurotransmitter. It looks for mold, right? I think that's one of the biggest most insidious infections. Mold's everywhere. My husband always argues with me, like, there's mold everywhere. I'm like, I know, but it's so much more aggressive now because our buckets are so much fuller, right? There are so many toxins in our environment today, and they just make the mold angrier. So now,
Oh,
yes,
yeah.
mold's been around since the millennia, beginning of time, but now it's just the toxins from the mold are so much more aggressive. And the biggest problem is that they suppress your immune system.
Yeah.
Right, so
Yeah.
we're getting more cancer rates younger and younger, and all these problems happening because the mold is just shutting down our immune system,
Yeah.
and that's a very, very hard infection to get rid of, but it's important to look for that, right? Because if we're in
Oh,
a
yeah.
rosy house, we're never gonna get better no matter how much money you spend on all the
Yeah.
biohacking, the peptides, whatever, even, getting stuff out of the infections in your mouth, if you're still constantly, inhaling those spores and creating more mycotoxins, that's a problem. So,
Oh, for sure, for
you know
sure. Well, I think too, it's important, like, I have grounding pads on everything now, and then, I have some people that are so sensitive to mold that, like, even if they don't put their, like, Aura Ring on airplane mode, I have them put it on airplane mode because all the EMF will just cause more of those mycotoxins to just flourish, and I have my Wi-Fi on a timer, so, like, anything kinda, like, prevent that, but yeah, mold is a beast, especially, like yeah, I mean, our immune system's already pretty shot just with poor diet and lifestyle and the stress, yeah, low, but it's you see more and more of, like, that mast cell and, like, I
yeah,
mean, p and SIBO, if you have SIBO, the combination of the 2, and mold and bacteria bind to estrogen, so you have all these women that are super estrogen dominant, eventually you got the cancer, yeah, it's a catalyst for sure,
yeah,
sure,
and
but
it's sometimes it just feels very overwhelming, because you don't know where but I like what you said, number 1, I totally agree. We gotta start with what we're putting into our body, so we've gotta start with
yeah,
the diet, and, it can be challenging because people all the time say to me when I ask about their diet, they're like, "I eat healthy," and I always ask, "What does that mean to you?"
whatever.
Because, right, like, I did a Viome test, right, and my body, I cannot break down all the glucosinolates, I think they're called, in all the cruciferous vegetables, right? They're supposed to be the healthiest vegetables on the planet, and I'm a person who has a defect in my glutathione path, so I really need the sulfur, but I can't get it from those foods because it makes me more
Yeah,
inflamed, and I thought that was fascinating. When I went to a more meat and fruit centered diet, my gut was never healthier. I mean, I kind of stopped eating vegetables other than like green beans and peas and zucchini, like unbelievable. And I thought, well, if I don't eat broccoli, I'm going to be in trouble. But so I think that's like when you're talking about doing food sensitivities and these tests, and they do add up. But I think it's important to understand how your body is
Yeah.
working so that you can optimize your health. There is
Optimize.
no
Yeah.
one plan for everyone. And that makes it a little challenging, like I have a family of 4 and we're all totally different and, we all actually need a little bit different my kids are both homozygous MTHFR, so, like, they need more detoxification support
Yeah.
than me and my husband, they're teenage girls and they don't wanna, they don't wanna listen to what I I have to say. I'm laying the foundation, so they'll come back around, I keep telling myself eventually.
Yeah, and sometimes, like, I mean, that's when supplementation can be really great and just,
Yes.
the methylfolate or something like that, different things like that can be helpful. Times like that, I think, like with my kid, that's what we do. We do high
Mhm.
levels of zinc and copper and 'cause he's got some behavior like mental health stuff, so it's been easier to do that, I think.
Yeah.
So,
I think, that's I used to shove so many supplements down their throats when they were little and they were pretty good about it. They could swallow stuff pretty early, and now, they push back about everything, but at
yeah,
least I try to get minerals in their body every day because I think minerals are just so, so foundational. Even though they really need like the methylfolate and stuff, I'm even more, pushing all those minerals because they're just so vital for all of our enzymatic reaction and our food. Our food just is so deficient in minerals today that and the one they take is such a tiny little pill, they usually don't fight me on it. Although, sometimes I go in the room and I find a pile of supplements, hidden,
right,
pot
right.
tissue box.
Oh, yeah, I found him under the couch. I mean, my guy's 8, so for sure. But he's splitting them with me, like the ones that you could split.
Yeah.
So I have a chewable glutathione that just came out, and he'll, like, give me half, and I'm like, "Oh god," like, I just injected a bunch. Like, whatever. But it's I think that we're planting a seed
Yeah.
and, we're also dealing with kids, so you
Right.
just plant the seed and then hope that, that's the best we can do, really,
Exactly.
for sure. And they'll come around if they feel sick enough, that's what usually happens,
That's very true.
so.
So on your website, you will really help coach people along. Can you tell us a little bit about some of the programs that you do or the type of patients you typically work with?
Yeah, I have a it's becoming a wider range than it used to be, probably due to peptides, I would say, because I now have a lot of guy clients that just wanna look beautiful, which is whatever. And, but they all have to do a GI panel. Everybody does a GI panel. I never skip that one. But I have a lot of women who just are really struggling with, like, burnout, constipation, hormone imbalances. They just don't there's the symptoms are growing rapidly each month, and the desire to, like they just don't eat, they can't work out anymore, and they're realizing that, like, their doctors are gaslighting them or completely ignoring them, and so they start seeking out other avenues, and so that's I have a lot of women, it runs from even, like, young girls with acne to, perimenopause. I have a couple in menopause, and then like, a lot of weight loss resistance, we work through that. I don't just hand out GLPs. I do some work with retatrutide, but I definitely make sure they're doing everything else and hormones are balanced and optimized, and we look at the gut. And so I do a lot of the functional lab testing, and then I work with a lot of people in recovery. So a lot of times when people get sober, they just don't whether they're addicts or not, like, you just quit, let's just say, or you're like me, I'm an addict, so, like, I had years of abuse kind of doing harm to my body, but you don't always feel good right away, and I think that's a high risk for relapse, and so when you can just get in there right at that right time to say, "Okay, here's why you're craving sugar all the time. Here's what's happening with the bloating. Here is why you have brain fog," and you can go in there and teach them. It's very empowering for someone who spent years just trashing their bodies, and
Mm.
so when you teach them a new way of life, it helps them appreciate their sobriety more, which is less likely chance that they're gonna relapse. There's a lot you can do to really I mean, your blood sugar, if you've been drinking, like, your blood sugar's a mess, your sleep's a mess, your gut's a mess. I mean, you name it, everything's a mess, and you're gonna feel a little better for sure in the beginning, but then you're gonna be like, "I want more," 'cause we're addicts. We always want more.
Mhm.
And so, when things aren't working, it's frustrating. I mean, it's with anyone really, but for sure when you're in that space, and that's just because it's a special space to me too, and I think everybody struggles with some sort of addiction. And I think that if you even have one drink, it's important to know that like that will just cause a dumpster fire of issues throughout the body, especially as you get older. That's why a lot of people are quitting in perimenopause because they just can't even handle it. Your NAD is low, I mean, everything. So yeah, yep. So that's kind of my bread and butter. I do have a lot of I have some chronic illness. I have a lot of people who just reach out because their mouth, just because they see what I've posted.
Mhm.
It's not really I mean, it's kind of my bread and butter, but it's definitely I'm not a biological dentist, but I'm very passionate about it. I
Yeah.
mean, it ruined my life for 3 years. Like, I
Mhm.
it really ruined it. Like, it was my relationship with my kid. I mean, I remember when I finally just, like, got out of the woodwork and, like, he put his head, like, towards me on my shoulder, like, he got near my mouth, and I didn't, like, freak out because I wasn't, like I hadn't had a root canal or, like I mean, I would get a root canal and literally come home and have to go back to work because it was so frequent. Like, there's no way I could have run my business. Like,
Mhm.
I would do implants and maybe take half a day off. But I always had to be a mom. And I'm a single mom. And so, like, not being able to have your kid near your face ever, and then, like, realizing what you've lost for 2.5 years and they, like, come near your face and you're not, like, running, he went through it. He has, like, he's like, he worries about my mouth and he went through it with me.
Mhm.
Ice packs on your face, stuck on the couch while you're just trying to take care of a kid.
Man.
I don't know what tangent I just got on, but oh yeah, people I like to yeah. I feel like I should be a mouth therapist or something. Like if it's
Well,
like
I
I
mean,
could
it's true because, our children,
have it.
they feel, right? Especially, the younger they are, they're still more in touch with their spiritual side, and they are getting a lot of their energy from us as
Oh
moms
yeah.
who are primary generally, this is a big generalization, but women are primarily the first caregivers. And so how we're feeling in dealing with things has a big impact on them and their
Yeah.
nervous system. So
Oh yeah. I was a mess. It was a mess. Just nothing good was going on. And I was just trying to, I'd take a bunch of steroids and antibiotics and then go like speak at a conference and then just like come back and be like, I would just pray. And that's when you have to. Like I'm such a, like, visionary, and I'm such a, like, I just wanna get grow, 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 do more, 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 and I would just pray. I would just like, that day I did the big thing in May before I got my that last tooth pulled, I do not know how I did it. It was literally by the grace of God that I did it, and I was able to do it, and, like, the times when I emceed a really big health conference, I just said yes. I was like, "I have no idea. I don't even know if I'm gonna have teeth at this point." Like, I literally, and I just said yes. And I had some we would, like, fill in temporaries, like, my biodentist would be like, "Hey, we're gonna get you all ready to go out there," and we just have, like, whatever it was we'd have, and I just pray I wouldn't, like, lose my partial or, like, a tooth would fall out, like, I'd be scared to fly, like, my tooth would just fall out, like, because teeth were just really falling out. So, yeah. Yeah, it's a lot, but
but you're on the other side, which is what
yes, I
should be
hope.
encouraging for everybody.
I hope. Yeah, yeah.
So, as we're kind of wrapping up the hour here, is there any important tips that you want to leave us
Mm.
with?
Tips, I'd be proactive, not reactive. So get in with a biological dentist, make that your primary for your dental health. I think it's really important. They're all over now. There's a lot of people doing it. I'm sure that you have a link that you can share. And I would go get like a cone beam and I would go just do some preventative work and make sure that you don't have any underlying infections. If you have metal fillings, get them out. You're wondering why you're tired and you have eczema and psoriasis and all these things, like, it's probably the fillings, and do it the right way, and then if you have root canals, definitely get them checked out. If you have a metal implant that you've had for a long period of time, go get it checked out. But I think having a biodentist in your toolbox is really, really important, for sure.
Yeah, absolutely. Somebody who's going to be looking where nobody else is thinking to look
Yeah,
is really great. And
yeah,
then, it's talking about having that team, right? Yes, you need the biodentist, but then you
and
need
then have one of me.
exactly you need the functional diagnostic nutritionist.
Yeah, yeah.
You need
Yeah,
somebody
to
who's going
balance
to
you do because it's so stressful, your hormones are gonna go. I mean, I had PCOS, went absolutely crazy too. I also do have a theory. So I ended up, I always forget this and then I remember it, but I do kind of have a theory. So I did end up having to get the vaccine, long story, but anyway, I did it. And I I think that's part of why my teeth literally started falling out. And maybe it's because I got COVID, but it happened so quickly after I got the vaccine is when all the teeth like, I had a crown that was also on there from when I was little, like, that fell off, and then things just started, like, happening with my teeth the second I got the vaccine. I was in the hospital with my PCOS, I had ovarian cyst, I put on 15 pounds, it was, like, on the floor in more pain than I was when I was pregnant. And so I seriously think that that vaccine and I'm not like, whatever, do what you wanna do, but I'm gonna tell you, I have another friend who did it, and her teeth just crumbled out of her mouth. She ended up pulling every single one of them and doing 4-point, like, dentures in both sides.
I mean, I have to say, I've been in practice 22 years, and at that point, it was, like a little under 20 years, and I had never seen the amount of rapid decay ever in my life. My patients who'd been stable for years and years, suddenly decay was just rip-roaring through their mouth. I mean, and I can't there's nothing else I can contribute it to other than the vaccine.
I know.
What we know now is that vaccine really suppresses your immune system.
Yeah.
And if you listen to my podcast, you know that I believe that the root of the decay really is a malfunction in the immune system, right? It's the imbalance of the bacteria. There's something happening, nervous system, digestive system, immune system. That's where we're getting the problem. So, yeah, I
I'm
mean,
sorry, I just threw a big nugget I just threw a big nugget out there right at the end.
yeah,
But
yeah.
I don't know. I don't know.
I
Sometimes
don't
I
know
think it's
either, but it's in
I
my
also I
experience.
also right, I
Yeah.
also smoked meth for, like, 8 years, so I
Yeah.
don't
But
could be
yeah, I
that.
mean, no, in my experience, it's very dramatic what I
Yeah,
noticed after that.
yeah. It'll come out eventually, we'll find
Yeah,
out.
yeah, we'll see. So, how can we find you? Tell us all your places
Alright,
where we can get in touch.
pretty easy if you just type in CFIT Living anywhere, so SEEFIT and then living, .com is my website. I do free clarity calls if you're interested in doing some of the functional work and the lab testing, to even go along with your biological work, whatever. I have a lot of I'm pretty active on Instagram, and that's CFIT Living, and you can see I have posts in there on my dental journey. You can DM me if you want me to send them to you directly because they might be hard to search for, but there's a lot of video. I've tried to document all of it because 'cause I'm like, "I'm gonna make a movie. There's gonna be something on this." So I would film it. I just have some horror films. Like, I never thought I would cry on Instagram, and I think right at that November, I was just I was so terrified. I was so scared, you know?
Well, great. Well,
But
we'll
yeah,
put
that's all.
the link in the website for the social media. So, thank you so much for taking
Oh, you're
time this afternoon to chat with the audience, and I think your story will probably resonate with a lot of people. And I think the most important thing is that don't give up hope, right? That
no, just it'll get better.
we can come through a lot of things if you find the right team. And like you said, right? You went through 6 ENTs. Like if the first one isn't the right one, go see somebody else. There is going to be somebody there who's going to be right for you. And yes, it's frustrating and tiring. Sometimes it's a lot of money and time, but the answers are out there. So number one, listen to your intuition, right? You know
Yeah.
best for you. You know what's going to resonate with you, but don't give up hope because there's so many great stuff out there. I think you probably piqued a lot of people's interest talking about peptides. They're really, really phenomenal. And I'm excited to use more. I don't use much in the healing, but now you've got me kind of thinking and
I got all the biodentists
yeah,
using
yeah.
it. I
Well,
got
we'll have to
some are
talk
like
after. Yeah.
and they're like, "I just started injecting it here." Like, I don't recommend doing what I did, but, like, yeah, definitely there you could do it.
It's good for the healing journey. Yeah. Excellent.
Yeah.
Especially those people with mast cell, they're so sick. Like you said, they can't even like have the simplest herb because they're so reactive. So you've
I
got to
know,
calm
yeah,
down that immune system first.
yeah.
So, well, that's awesome. Thank you so much for your time. I hope everybody enjoyed this episode and go check out Samantha on her website, cfitliving.com. Check her out on Instagram, give her a follow, and we'll see all of you on the next episode. Have a great day, everyone. Huge thanks to you, our amazing listeners, for helping us climb into the top 5% of podcasts in the oral health space. With all the love and support, we've been getting many requests for one-on-one consultations. So we made it happen. Are you ready to take your oral health to the next level? Click the link in the show notes to book your personalized consultation, and let's kickstart your journey to a healthier, brighter smile starting today. We'll see you then.